Okay, so now we're going to irrigate a Foley catheter. We are going to do both open and closed irrigation, so stay tuned. Okay, anyway, so we have checked our orders, made sure we have the right patient, the right catheter. This says 10 milliliters of gentamicin and irrigate with normal saline. And then it says leave there for 2 hours. So first we're going to do a closed irrigation. So what we're going to do is open up our package. Again, make this somewhat sterile. Okay. Okay. So we're going to pour 10 milliliters into here for our closed. And then this is a needle system. So I have a syringe with a needle. I'm going to fill it, it's a 12 cc syringe. I'll fill it up with 10 milliliters. Go ahead and take it off. I'll pull it up without the needle.
Alright, so can I put you down for my first video? I'm now going to do a placement on
Okay, so I have 10 milliliters. I'm going to attach the needle, open up my alcohol pad. I'm going to clean this area just to maintain sepsis. Okay, then we're going to go ahead and clamp down here so the saline goes into the catheter instead of back out. And make sure not to put this down because I've already cleaned it.
And like I did in my first one, I come and introduce myself.
I'm going to go ahead and insert the needle. I'm going to try to keep it up higher a little bit just so the saline flows back into the bladder instead of back down.
But then I would identify them, ask if they have any allergies, especially to betadine, and would go ahead and put them in position, which is like the same for the male, where you want to slightly abduct the legs. And then
okay, so then I'm going to go ahead and leave them like this. The orders say for about 2 hours. Seems kind of long to me, but I'll leave it like this and let it all flow in there. Then I'm going to chart the output, so I'm going to subtract the amount of fluid that I put in there from the amount of output in the bag, just to make sure the urine is flowing properly and there's no like sediment or anything. Okay, so then for our closed system, again I'm going to check our open system, sorry. Again I'm going to check the orders. I'm going to make sure I have the right patient, the right time, the right amount of fluid. Okay, so for our open, again, we have about 10 milliliters of fluid. Oh, 500 milliliters. Okay. So we're going to pour 500 milliliters into here. Okay. And then I'm going to use this larger syringe. So what I'm going to do is I have a gauze package to maintain sterility. I'm going to pull this. Oh, here, I'll do this first. I'm going to pull up the amount of fluid that I need. Okay, so my syringe is full. Now I'm going to separate the two parts of the catheter. Maybe.
Gloving my dominant hand first.
Okay. Now I'm going to make sure not to put this down. I'm going to go ahead and set this into the sterile gauze package so it stays clean. Okay. I'm going to insert the tip of this syringe into the catheter. And go ahead and irrigate. If the patient has any like sediment or anything that could be clogging it, you might have to go back and forth just to make sure all the fluid gets rinsed in there. Okay, so then once I've done that with the amount of fluid for the orders, I'm going to take this off. I'm going to attach it again. And then depending on what the orders say, I'll either clamp it for a little while just to make sure all the fluid gets in there, or I'll just go ahead and leave it run out. After that, I'm